The diagnosis of SLE or systemic lupus erythematosus is based on the clinical features, like when a child presents to us with ongoing fevers, rashes. A very classical rash that we see in some of these patients is called the butterfly rash that appears on the face. Many of these children have oral ulcers, hair fall, and joint symptoms with joint pains. And when we do their blood test, a specific test or a very important test that we do to pick up autoimmunity is the anti-nuclear antibody test. As in this child, the anti-nuclear antibody test was positive and she had many symptoms of lupus. So we say, yes, your child has systemic lupus erythematosus. This is an autoimmune condition. That means the body's white blood cells are not doing a good job and they are attacking our own cells. We must stop it. And to stop it, we must suppress our immune system to a certain extent. And that is why the treatment will involve immunomodulation, immunosuppression with steroids. So most of these children, we will start them on steroids, but then do not bother. We will also start steroid sparing agent. That means another medicine that will help us take out the steroids as early as possible. I'm sure many parents, the moment we say that you are supposed to be started on steroids, would get scared because they would feel that these steroids may damage the bones, the growth of the child. But let me remind you that we are discussing it in open, telling you why your child has to be started on steroids. It must also be remembered that it is not going to be given for a very long time, but for a limited period, along with other agents that will help us control the disease. How long do you give these medications? The treatment duration would vary from one child to another. While most children will need treatment for at least 2 years, in some children where there is involvement of the inner organs, for example, if kidneys are involved, we may have to give the treatment for many years. Now, can we cure this disease? This is a very important question that bothers many parents. One must remember that a few decades ago, when SLE was first described, we did not have many forms of treatment. I think we only had steroids. Today, because of advances in medical science, we have more than 10 different types of medications that can be given to control the disease in this situation. So I'm very hopeful that with the advances in medical science, it is possible that in the coming decade, we may in fact have a cure. But right at this moment, we don't have one medicine that can cure this disease. But it must be remembered that if children are treated appropriately, they would have a completely normal life. They can go out, play with their friends, have a normal schooling. But if not treated, they would suffer and have damages that are irreversible. And that is why it is very important that these children are treated in time.